Don't be scared. Nobody's biting here. Konkurencja, tak. Okay, time is pressing, so let's start. I would like to very cordially welcome everybody who came here. First of all, the members of the authorities of our university. Professor Michał Żmijewski, Vice Rector for Science, which is the most important function, I believe, at least in my opinion. It's also my pleasure to welcome my vice directors. I should introduce myself first of all. I'm Professor Jacek Witkowski. I'm the head of this doctoral school. Okay. My vice rectors are Professor Michał Pikuła, who is over there. Michał, show yourself, who will have a lecture in a moment. Professor Jędrzej Antasiewicz for health science. Professor Pikuła is for medicine, discipline of medicine. And Professor Iwona Inkielewicz, but I don't see her here today yet. We don't know anything about Iwona. Okay, but could be. Also, I would like to welcome all of the members of administration, my office, and the head of our office, Ms. Marzena Chlewicka, who was very, very substantial in organizing all of these open days. So together with the rest, we have here Ms. Lidia Kotlarska-Liszcz. The two of them did this job. That's what I'm saying. I was just trying to help. Okay. If I missed anybody and did not mention any names, sorry. But I believe almost everybody from the administration who are here will have a chance to say something to the students. I believe that the students who are here, you are from mostly 5th and 6th year, yes? Is this so? Yes, okay. And therefore I believe that you might be, and I hope that you might be, interested in joining the school and going forward with your scientific activities all the way to getting the diploma of the philosophy doctor or PhD. I hope for that very much. And today, in this second in history open day of our school, we'll try to convince you and also those who might be watching and listening to me and to other people who will be presenting anything on the internet, because we are on, I believe, on the Facebook, on the page of the university. Are we also in the YouTube? I don't know. Yes, okay, so whoever would be interested, they are, hey, welcome. Hello, please come. Whoever is interested but could not join us here in this room can do it, and hopefully does it on the internet, on the cloud. All right then, so, and of course I welcome all the interested students, because that's for whom all this event is actually aimed. All righty. At this moment I would like to invite and ask Professor Michał Żmijewski, the Vice Rector for Science, say a few words for the opening.
Thank you very much for kind introduction. I'm happy to be here. I'm happy to see so many young people here. I mean, everybody of us is young, but we are also counting on the youngest who are going to join hopefully our first PhD school at our university. This is my honor to kind of open this day in the name of our rector, Professor Michał Markuszewski, who is actually traveling today, so he is not with us, but he's sending everybody a warm welcome to our university. And I hope that you have this feeling that you are in the right place, starting your scientific career at MUG. I'm talking especially to people who probably are watching us online, because those who are here, they probably know a little bit about our university. They are our students probably, or former students, so they know a little bit about university, but I would like to stress that we are only one university in Poland which has the status of a research university, only one medical school in Poland, and we are profiting a lot, especially science is profiting a lot from this program. We are giving grants to students, to young scientists. We are trying to invest as much as possible in not only science, but also on traveling expenses. So if you think about doing a part of PhD somewhere else, we can support it. So this is a great opportunity to start scientific career in Gdańsk, especially that I can sense that it's difficult for medical professionals to start PhD career, because they, especially medical doctors, they have other opportunity to work and be satisfied not doing a PhD. But I want to assure you that doing science is something more exciting than even earning money. It's something which you can do. That's what I said a couple of days ago, opening students' conference, that being a medical professional is great job and great opportunity and honor to do that. But if you think that you can actually make it better, like doing research, make better treatment, make better procedure, improve something at our university, not only in our university, but around the world. That's really great task to do. And I hope some of you will commit at least part of your life to do science, not only being a medical professional, but also being a scientist. This is a great opportunity, and I want to ensure you are in the right place in right time. We have a great hospital. We are going now to focus more on translational science. So whatever you are planning to do here is going to end up in a clinic sooner or later. So this is a great opportunity once again, and I'm not going to make my speech longer. I'm going to give a microphone back to Professor Witkowski. Thank you very much. And please join us.
Thank you very much, Professor. And this was very heartful and hopefully encouraging people. So, thank you again. So, a few words about the school for those of you who probably don't have any idea about what such a school is. Okay, as you can see, we are the first doctoral school of the Medical University of Gdańsk. I had it from the beginning, and the beginning was already 6 years ago in 2019 by the decision by Rector Magnificus, based on the law, which is common for all Poland. By the, as you can see, it's somewhere here. I will not go in details, but this is what rules generally the school. But of course, this is not only the rules, because we have the regulations apart from this disposition, apart from the law. We have regulations of the school, which are, as you can see, still sometimes updated, because the general rules change. Some situations occur that require some update, adjustment for the regulations. Of course, the education in the school goes along a specific program, which is all of this is on the web page that you may access. This is open. Of course, terms and procedures of terms and procedures of recruitment, which are also very specific, and then terms and procedures of something which is called the midterm assessment, because for those of you who may not know, after 2 years of education and working in or at the school, during these 2 years you get slightly lower stipend. You get the stipend because it is by the law, so every PhD student gets the stipend. And the amount of stipend is somehow related to the money that full professor gets in the school. It's some percentage. But at the midterm, after 2 years of staying and working, of course, hard at the school, every PhD student undergo the midterm assessment, how well or how badly this person performed over these 2 years. And this is very serious because the only possibilities are yes, they passed, no, they failed. If they fail, they are relegated from the school. If they pass, they do what they did before, more intensely possibly, and they get a bit higher stipend, which is also some incentive. Now, what's the structure? Of course, there's the director. There are vice or deputy directors for farm, medical, and health sciences, which we together call the directorate. Then we have the board, which is composed of the plenotitular deans or vice deans of each faculty, chairpersons of the discipline boards, because it is again the rule that the discipline board is actually performing the procedure of after the schooling at the school is completed, after the thesis is submitted to the discipline board, and from then the discipline board is doing all the required movements. And of course we have people coming from the council of the doctoral students as well. All of us are devoted to the most important part of the school, who are the PhD students. Yes, we teach, we help them with all other matters. Yes? So, what are the goals of our school? Let me stand like that because it's better to see. So, we want to make better doctors, and not just medical doctors, but PhDs, which are the scientists. Better, which means also internationally competitive and recognizable and recognized eventually. So how do we attempt to do it? By increasing interdisciplinarity of the doctoral thesis, which means that the thesis may be both in medicine and health science, in medicine and, say, informatics. It's up to you, to the future PhDs, with your supervisors, with your promoters, to choose what you want to do in science. Then we increase the internationalization of the doctoral school, because we accept also people from abroad, people who do not speak Polish at all. And it will show up in a moment, but I mentioned now that all the classes at the school and all the proceedings is done in English. That's in order to facilitate people who would be and are coming to the school from abroad to benefit from all of the teaching and all of what the school offers. And yes, the level of education mentioned here is conforming to Polish and European qualification framework at the 8th level, which is the topmost. A bit about the program. There are 4 years, and altogether our PhD students have to do 165 hours of compulsory courses, 45 hours of elective, and practical training, which is teaching, which is aimed to, let's say, teach the PhD students to teach the students. Because some of those people would eventually stay at our university as assistants, as teachers, or at other universities. So they need to learn also how to teach. So these 2 columns are obligatory. Now, how they are split. In the first year we have total 30 hours, but please mind this one. At the end of every academic year, we have doctoral seminars. After first and third year, the seminars are in individual disciplines of science, meaning that the doctoral students meet with us, with their supervisors, with other interested people, and present what they already did, what they want to do, and this is, of course, open to discussion, to scrutiny, etc. They have also some other important subjects, but I will not go into detail. Going to year 2, only apart from the doctoral seminar, just 2 subjects, not too much, as you can see. After the second year, the doctoral seminar is interdisciplinary, which means that all of the second year students from all 3 disciplines join together and present on the broader field, which allows people, say, from discipline of and doing the PhD in say, pharmacy, to learn something about topics and schemes and methods that are done, say, in PhDs in medicine or health science, and vice versa. So this we decided to introduce some few years ago, and it's quite popular. Then we have, of course, the third year, when the special thing is these 3 quite large topics, propedeutics of medical, pharmaceutical, and health sciences. But it is, again, for making the doctoral studies more comprehensive to everybody who undertakes it, meaning that if somebody has a diploma from medicine, is a medical professional medical doctor, MD, such a person does not have, of course, to go through propedeutics of medical sciences because they already know it. But they should learn a little bit about pharmaceutical and other health science, and vice versa, depending on what the diploma, master's or doctor's diploma they have. Yes? Altogether it's 75 hours, but in fact it will be only 55 hours. Then, last 4th year is just one activity, one formal activity, which is the interdisciplinary seminar. At this level, practically, and we always hope for that all of the PhD students should be near completion of their PhDs, should be ready to present and write and present their thesis. Okay, enough about this. Whoever is coming, please join us. That's for those of you who do not know, this is Professor Iwona Inkielewicz-Stępniak, my deputy for pharmacy. So welcome. Okay. This PhD students, people who are the most important and for whom we are doing this job. As you can see, currently we have altogether total of 166 PhD students, proportionally, mostly by numbers in the discipline of medicine, but it is somewhat proportional. We have 12 people from abroad, from really literally from all around the world, including China, India, Pakistan, and other countries. People who do not speak, almost don't speak any Polish, so as I mentioned, our classes and proceedings are in English. We have 32 PhD students who are funded not by the ministry, as the law asks, but from so-called extramural funds, like, first of all, and proportionally the most, which is the IDUB, which is Excellence Initiative Research University, which our university, medical university, is boasting as, I believe, the only one from medical universities. Then National Science Center and industry, so-called implementation doctorates, where somebody working in pharmaceutical or other related industry is doing the PhD, like in cooperation between his employer and the university. As I mentioned, everything is done since a couple of years ago exclusively in English, which also, and if anybody from outside, from abroad, is listening to myself, all of you are also cordially invited to join our school if you find this interesting. All right, that's it. I don't want to prolong too much. Thank you very much. And once again, heartful invitation. Join the school. Join the first PhD school of the Medical University of Gdańsk. Thank you. And now, the program is here. And now is time for the lecture by Professor Michał Pikuła, who just left for a moment, I believe. Okay. One minute, okay. I believe there will be time for questions and discussions in a few minutes at 11, because that's what my piece of paper tells me, that it's a networking time. All of you are and will be invited to join at the catering space for sweets and other fine things. Okay, where is Professor Pikuła? When he's necessary. Okay, things happen. Hele, the floor is yours. Hey, don't. Okay. Don't run.
Okay, so good morning, everyone. Welcome in our university and doctoral school. So my name is Professor Michał Pikuła, and I'm a deputy of doctoral school director, and also group leader in the Laboratory of Tissue Engineering and Regenerative Medicine Lab. So welcome all of you at our university. Today I would like to give you a short overview of the thing that we are doing in my lab, but also generally a little bit about our university, focusing on new strategies for regeneration. So a little bit about our project and our ideas of strategy of regeneration. So as you may know, we are very proud that the fact that Medical University of Gdańsk, as the only medical university in the country, in Poland, has been selected to the elite group of top 10 best Polish university. So we are the first medical research university in Poland, and in our university we have three, let's say, priority research areas that are cardiology, oncology, and biochemistry, also called Discover Science, that I also present that field of science. So we form a foundation and background and very important methods for also for oncology and cardiovascular cardiology field of medicine, focusing on biochemistry, genetic, molecular biology, and all that fields very connected with that. So I'd like to also mention that at our university, we would like to and want to support young scientists, including PhD students. So we have lots of program dedicated for young scientists, especially to support students, scientific society, to design, develop competency needed to function in modern world. Also, we prepared a workshop for young science lectures. So generally, there is lots of this kind of program. So now a little bit about tissue engineering and regenerative medicine. It's quite new branch of science which connect different field of medicine, different field of science. That's why, in my opinion, it's so very interesting. So we try to connect the biotechnology, molecular biology, nanotechnology, and we say that there are three main elements. We say that there are three main pillars of that. So there are cells, scaffolds, and growth factors. And thanks to this translational nature, tissue engineering constitutes the basis of regenerative medicine and also personal medicine. So this field of science, this field of medicine, we like to develop in our university, in our hospital. So, as I mentioned, there are three pillars that if we want to create the scaffold substitute for personal medicine, for regeneration, first we need to have cells. We can use different kind of cells, mainly stem cells, but of course there can be different cells. Signals, you need to know that cells without signals, they undergo apoptosis. They do not work. So if we think about it, if we want to transplant something, if we want to prepare the scaffold, we need to support them by the signals, growth factors, peptides, and many others. And of course, biomaterials, which they form physical support for the cells, for the tissue, can be also different. And you can see that the implication of that and the consequences of that is the new drugs, nanoparticles, new cell therapies, regenerative medicine, but also oncology. I will tell that a little bit later, that oncology also demands formation of scaffolds, stem cells to repair, to regenerate tissue after chemotherapy, radiotherapy. You know that oncological therapy possesses lots of side effects. So, as I mentioned, cells, they can be autologous or allogenic, so the same patient or from different patients. They can be cell line, primary cells, stem cells, progenitor cells. I don't have enough time here to develop that, but the general overview. Biomaterials can be synthetic polymers, natural polymers, and regulatory signals, mainly growth factors, but can be also peptides, small compound. This is also very important now. So, as you know, growth factors, protein generally are quite expensive. So this is what we want to do with the cooperation with the chemists, is we try to develop, create small peptides, which will be much more cheaper. We can modify them, and we can use them as drugs. Also, mechanical stimulus. This is something that is also important because normally cells in our organism, they have mechanical stimulus. Okay, there is a pressure, many other things. So we need to also remember about it if we think about transplantation of cells to the patient. Okay, that's our lab with the equipment. So we use, for example, flow cytometry to analyze cells, 3D printer to print the scaffolds, laminar flow hood to appropriate sterile working. So strategies for regeneration. This is example of the bone, but generally it can be any other tissue. So we can have this quite simple scaffold, quite simple material. We can inject, we can implant the scaffold. That's the first that surgeries that they do that normally. But we can also modify them, so we can connect to the scaffold different protein, peptides to support regeneration. Can be, for example, PDGF, platelet-derived growth factors, or BMP, can be also small molecules. But also we can connect that with the RNA, with the transcripts, with also other compounds. And then we have something that we call ATMP. This advanced therapy medicinal products, according to the European Commission. And this is something that we transplant not only biomaterial, but we transplant with the cells. And can be, for example, stem cells from the adipose tissue, can be the stem cell from the bone marrow. So you can see there are different level of that, different level of advancing that, and we can support regeneration. So The idea is that we take the fragment of the tissue, we take the fragment of, for example, skin or cartilage or bone, then isolate cells. We can expand them in vitro, we can modify them, we can connect with different biomaterials, and then we can transplant to the patient. Okay, that's the idea of the autologous transplantation. We can also use autoallogenic, so we can have a healthy volunteer, healthy patient, healthy person, take the tissue, isolate cells, and then transplant to our patient. So as you may know, we have different tissue with different population of and proportion of stem cells in our human body. We have, for example, bone marrow, there is lots of stem cells, and there is a high regeneration. Skin possesses also quite number of stem cells, but also there are some tissue like brain, heart, kidney, with very, very poor possibilities of regeneration. There is very low level of stem cells. So if you want to isolate the stem cells or progenitor cells from this tissue, it's quite challenging. So in our lab, we use mainly stem cells from the skin and from the fat tissue. So fat tissue, as you may probably know, is very often waste after the surgery. Can be liposuction, can be other surgery, and after this procedure, like liposuction, we can have quite a lot of amount of fat tissue, and then we can isolate the cells from that. We can isolate stem cells, we can isolate adipocytes, but we can also isolate and take the vessels. And you know, in the vessels we have endothelial cells. And we also can culture endothelial cells, which are very crucial if we think about formation substitutes in vitro, because the blood vessels are important in the regeneration. So also we do that in our lab. So this is the example. This is the culture and expansion of stem cells. This is after enzymatic isolation. This is what we call stromal vascular fraction, which possess not only stem cells but also immune cells, erythrocytes, and other cells. We can expand them in vitro. And what is important, stem cells from the fat tissue, they culture very nice. So they expand, they grow very nice, and we can use them in the future in the therapy, but we can also use them as a model for drug testing. What is very interesting is that we don't see actually here in these cells age-dependent effect. So even if we have a donor which is quite old, they proliferate quite nice. So this is something important for us. So they can differentiate. So we can, using appropriate growth factors, appropriate conditions, we can differentiate them to the adipocytes, to the osteocytes, and cartilage, chondrocytes. So this is important in the regeneration in the personal medicine in the future. We can also can have the quality control, so we can analyze the surface markers of the cells. So why they are so important? Because they possess lots of very important capabilities and properties. So for example, they can differentiate, of course, as I mentioned before. But they can have they have also immunomodulatory properties. For example, they produce interleukin 10, TGF-beta, which they have immunosuppressive properties. Very important, for example, in systemic sclerosis, on many autoimmune disease. In fact, there are lots of clinical trials now based on the adipose-derived stem cells in the autoimmune disease. Organoid formation, that is also we doing in our lab. So organoids are important when we have the drug testing in vitro. There are vehicles for drug delivery, modeling extracellular matrix, very important in the chronic wounds, keloids, burns, and they have also very important, and there are produced lots of growth factors and exosomes, which are also important. Okay, so analyzing them, I will not go about the details, but we can analyze them using different methods. For example, using single cell sequencing that we're doing in cooperation with other labs. And when we have appropriate analysis of the cells, we can use them in the clinical trial. This is one of our our paper about clinical trials of the adipose-derived stem cells. Also, we have some data comparing different stem cells from different origins, for example, with the fibroblasts. Fibroblasts, when you look at the fibroblasts on the surface of the cells and in the vitro, they looks pretty the same. But when you take very deeply analyzing, single cell analyzing of the cells, you see that there is a huge difference between stem cells and the fibroblasts. So single cell RNA sequencing can show you the differences between these cells, and also this possesses lots of clinical implication if you think about the therapy. So these are the comparison. That's general overview. Unfortunately, I don't have enough time to tell you about the details, but this is in our paper. Okay, wound healing. Wound healing is also important in the regeneration, of course. There are stem cells in epidermis and in the skin. So we are very also interested in the stimulation of wound healing, especially in the elderly people, burn patients, and diabetic patients. This is very crucial. And what is important that we are able to isolate stem cells from the skin. They migrate quite nice. We can analyze different peptides, compounds, and look how these compounds stimulate cells in vitro. So this is quite nice method to do that. We can also form epidermis in vitro, so stratify epithelium that you can then potentially transplant to the patient. We can also culture explant. Explant are the fragment of the skin. So you take from the patient, you culture them in vitro, and also you can measure, analyze different things. You can add some compounds to check the effect of that compound. I mentioned before that stem cells from the adipose tissue, they proliferate quite nice, even from the elderly patients. In the skin is different. Skin, as you know, is very sensitive, and because there is protection from the chemical compounds and many other things. So we do see lots of differences, age-related differences. You can see even here, very simple picture. This is 12 years old patient and 52, and even here you can see the differences in the differentiation, proliferation of the cells. So we do see that differences also using much more advanced techniques. So the idea is that you can take these cells, they proliferate in vitro, you can join with the scaffolds, forming the substitute and forming the substitute of the skin to transplant in the future. So oncological patient, few words about oncology. We also cooperate with the Department of Oncology. First thing is chemotherapy, radiotherapy. As you know, they exert lots of side effects. So in the different level of the tissue. So this is our idea, how to prevent that, how to regenerate the tissue after chemotherapy, radiotherapy, but also after surgery. Sometimes the surgery can be very advanced, so you can take really huge amount of the skin, for example, and then you can replace that. You have to regenerate it. Also, we have some projects connected with the cachexia, which is also a challenge for the oncology. So as I mentioned, chemotherapy exerts a lot of side effects. For example, skin toxicity. We can observe delayed wound healing in patients after mastectomy, undergoing pre-operative chemotherapy. That's the challenge. We are also looking for nanoparticles that have anti-cancer activity. We analyze now with the cooperation of other university this kind of nanoparticle that will kill the cancer cells. And we cooperate with the Sapienza University, Roma. This is one of the oldest university in Europe. It's quite nice cooperation with this university. We also are trying to analyze peptides. As I mentioned before, peptides are very, very promising potential drugs. One of the reasons is that they can be modified, chemically modified, but also when you look at the global peptide therapeutic market, you see that it's really, really huge. So we think that peptides can be very promising and very nice alternative to the protein. So we synthesize them with the cooperation with the chemists. We analyzing in vitro safety using, for example, immortalized cell line, primary cell lines. We also, before we put to the patient something, before we accept that we need to have some immunological tests, for example, allergic potential or immunogenicity. Peptides, we also analyze stem cells after peptide treatment. This is one of the example of that, PDGF. This is very small fragment of growth factors, but very active, and we prove that these peptides stimulate proliferation of stem cells in vitro. Also, we are very interested in the epigenetic regeneration. Maybe you heard about epigenetics. This is a very nice, popular, and probably very promising field of medicine. So we analyze different epigenetic modulators to stimulate regeneration. This is one of the example. You can see on the animal model that stimulation of regeneration of the cartilage and the skin was really visible. 3D printing, also promising strategy. I think that could be also the future of the personal medicine. So you need to have scaffolds with the signals, with the cells. You can print that, and there is really lots of potential application of 3D printing, for example, bone defects, wound healing, cartilage damage, diabetes. Advantage, high precision, high resolution, possibility to personalize medicine, but also lots of challenges. One of the most important, in my opinion, challenge is that cells during the 3D printing are very sensitive to the environmental changes. And if you change something like a pH, or stress, or mechanical stress, or many other, oxygen, for example, everything can influence on the cells. So this is one of the challenge with the 3D printing with the cells. So applications, tissue mimic, drug testing, tissue vessels, near future transplantable tissue, maybe in the future also the organs, skin. I know that this is really happening now in some clinical trials. So we cooperate with some university like Gdańsk University Technology with the optimization of this process. I'm not going to tell you the details, but just to tell you that this is really a challenge. So if you change something in your material, if you change something with the compounds, everything can influence on the cells. So this is the challenge, and we analyze the viability of cells, because it's not easy. It's not problem to print the scaffold with the cells, and you can see the fragment of tissue. But the challenge is, and the problem is, that the cells need to be alive if you want to transplant them to the patient. So that's the real challenge. So you can see here the viability of the cells was quite nice. This is the green cells, viable cells. Properties, of course, I'm not going to tell you the chemical structure and the details, but generally there's lots of properties which are very crucial: physical, chemical, like degradability, toxicity, biological, and lifetime. This is what we're doing now with the biomaterials, is to joining the biomaterial with some active compounds, like the peptides, protein, so we modify them. The ideal thing is that they will release the drugs in a patient. So that's the thing that we are doing now here. Okay, some examples. Also, we're working with the cellulose. This is quite nice, also biomaterial for clinical application. Gels, like here you see example of gels. Challenges: safety, modification, design of function. Of course, avoid immune response. This is what we're working also in our lab about it. GMP components, sterility, storage, long-term monitoring. This is something which is still a challenge for the future. So the idea is in the future that we can take the stem cells, the tissue from the patient, isolate stem cells, propagate them, and then join with the scaffolds, with the biomaterials, and then transplant, for example, to the cartilage. This is the membrane that could be implanted into the joint defects. This is from our recent publication. This is some our publication, especially about the biomaterials and regeneration and stem cells. I would like to mention at the end some of our co-workers from the Regenova consortium. So that was the project dedicated for searching for new compounds with the regenerative properties. Then we had a second Biananova. This is also similar project focusing on nanoparticles, also stimulated regeneration, modern material technologies based on the FAC display technology. So in the summary, you can say that stem cells are promising tool in tissue engineering. Stem cells from the fat tissue are easily obtainable. They present high proliferative potential. Fat tissue from the oncological patient also may constitute a valid source of stem cells, but also peptides can be very useful in the treatment of non-healing wounds. And I think that the peptides with the stem cells and biomaterials, they can form very nice foundation for the formation of the scaffolds. So we cooperate with the university from the Poland, but also from other countries. I would like to thank all these members. This is my team from the Laboratory of Tissue Engineering and Regenerative Medicine. At the end, I would like to mention that we form in Gdańsk Fahrenheit Union and Fahrenheit University. So this University of Gdańsk, Gdańsk University of Technology, and Medical University of Gdańsk. So this is our building, Collegium Biomedicum. There's our lab here. And thank you very much for listening. Of course, I would like to tell you at the end that Gdańsk is a beautiful city. So they're really nice to be here. So if you have any doubts, you can contact with us and our doctoral school. And I think it is promising for you. Thank you very much.
Thank you very much, Professor. That was very, very interesting. I believe very interesting for all of us here and to all of our witnesses on the internet. For the prospective PhD students, you can join projects like that. Very exciting, very promising. And this is not the only such project by our professors, by our scientists. So you will have a choice if you decide, of course. All right. First of all, any questions to the professor, to the lecturer? Anybody wants to know something more? Before we adjourn to the couloirs, of course. I don't see. Any questions that you would have to me regarding the working of the school, which you would like to do public because it may be relevant to all of you? Because later we can discuss things, let's say in semi-private, face-to-face, while others will be eating and drinking. But some things may be important to be said just now. Anybody? Perhaps something will perspire later. All right, it's now 10 to 11, so we are a little bit ahead of time. So we can actually adjourn to our break. Yes? Is everything ready over there? I think so. Okay, so thank you for now. And remember that at 12, at noon, there will be a lecture by Professor Aneta Radziw-Balicka. The lecture will be online, so you will witness it on screen, so you may somehow possibly rearrange the seating place. Okay, thank you very much, and Welcome again in the second part of our open day. Slight change of the harmonogram for today, because before the online lecture by Professor Aneta Radziwan-Balicka, we'll have a small presentation by one of the doctoral students, Ms. Joanna Ryczkowicz. And this presentation is already on screen, so is Ms. Joanna with us? Here, okay, welcome. The floor is yours.
Yes, thank you. Thank you for this invitation and the opportunity to say some words from the PhD student perspective. My name is Joanna Ryczkowicz, and yes, I'm a PhD student now. Actually, I'm finishing the second year of the studies, and I will briefly tell you about what motivated me and how my pathway looked like. Oh, it doesn't work. So, do it differently. Excuse me, it doesn't change. this slide. It doesn't work. Yeah, great, thank you. Well, science is growth. When we read that, we sometimes think of progress of knowledge or innovations. But for me, being at the first doctoral school at the Medical University of Gdańsk, it means that science grows in different dimensions. Why? Because I realized that science is not about only data gathering and publishing the results. It's a change of thinking, of how to ask better questions, or how to handle the failures, or how to collaborate between disciplines. Science is a space of a place where both human and science are constantly evolving. For me personally, science is a place where my intelligence is excited, where my emotions are opened, and where we can find answers to our questions. So, science requires both courage and humility. Why? Because in science we grow. How I grew into science? Well, my journey started here at the Medical University of Gdańsk when I started the public health studies. And during the studies, I met Professor Jędrzej Antosiewicz. I had the classes with him, and I was so amazed by his work that I wanted to challenge myself. I wanted to try myself if I can handle experiments, if I can handle lab work, and I volunteered to his laboratory. And what was the end? The end was that I was administered to the first doctoral school at the first rank in the ranking list in discipline of health sciences. Well, my project focuses on bone health of women over 60, basically. Well, how does our working week looks like? There are no 2 weeks that are the same. These pictures are practically made by me, except for the one in the middle that was taken by my friend Helena. As you can see, this is a short glimpse of our work time. Here in the first photo, there's Professor Jędrzej and our team workers during experiment. On the second, we are struggling with article, and you can see Dr. Angelika Borkowska, she is absolutely exhausted, and sometimes it looks like that. On the third photo, it is me with my friends at the hospital. Here on the fourth photo, this is Dr. Angelika Borkowska and Professor Ewa Zieman. We are taking training of new analytical technique. And the last photo is from our experiment. Our patients are taking workout. Well, every week is full of surprises, but luckily, most of them are the good surprises. Of course, my PhD project takes lots of time, absolutely lots of time, but as you know, I sometimes like to challenge myself, and this is the effect of these challenges. The first is Project Optima Mind. This is the project that won founding in Era for Health competition that was organized last year. It is the founding under Horizon Europe, and only 15 projects from Europe received founding, and our Optima Mind project was the one of them. This year in February, we officially launched the project. And the second project is Inflascope. This is one more commercial. It is based on application that assesses your inflammation status. And last month, we received the prize organized by Olivia Business Center. And these girls, Dr. Angelika Borkowska, Dr. Ulana Juchas, and engineer Zuzanna Margas, we are responsible for the project. So as you can see, these are my additional activities. Scientific one, Optima Mind project, and commercial one, Inflascope. Well, growing isn't always easy. Well, the administration part of the project is absolutely enormous, and you might often think that conducting an experiment is easy, but in fact, it is all timelined by administration. The decisions, the agreements, the delays, they always shape your experiments. So this part, it's not easy. Of course, you always need to learn new scientific fields, sometimes ones that you are not very familiar with. And of course, what you need to learn, not to be ashamed of asking questions, because it's better to ask twice than not to ask at all. What do I wish I knew before starting PhD studies? Yes, it's gonna be a huge mental journey. I wasn't aware of that, but we've got lots of amazing teachers that are always helpful, that give advices that are very open, and this is absolutely priceless. So if you are thinking of applying, just challenge yourself, try yourself. Maybe this will be your path. And first doctoral school of the Medical University of Gdańsk is absolutely a place where your future begins. So good luck in your journey. Thank you.
So thank you very much. Very nice talk. And are there any questions, maybe, from the candidate, from other people? About how we study? Any technical questions?
Yes.
Go ahead. So maybe your comments about the applying.
I will give one comment. Well, yes. The first important thing is to collect all the necessary documents. The documents that will give you extra points. For example, conferences, publications, and this is important. But
Sorry, Joanna, but tell them that before going to doctoral school,
you can tell it. So you can tell it by yourself. Yes, it was.
More than 1 year working in our lab, preparing actually for entering the PhD.
It was even quite more because.
1 year and a half.
Yes.
Any comments to microphone?
It's okay.
So yes, this background is very important. And after collecting all the necessary documents, then you have the examination. This is the examination made by professors from the first medical doctoral, yes, by commission. You have to present your project. You have to convince them that you are able to manage it. And after that, you get a qualified classification. And if you are that good as all our PhD students, then you will join the first doctoral school of Medical University of Gdańsk. So it might be challenging, but it's manageable. Of the project, yes.
Like already prepared.
Yes.
Right? Can it change during the study, during the like the whole course of the PhD of the school? Like
This is the question too.
Yeah, so that's very good question. So I would like to underline that before you apply to our doctoral school, first that you need to do is to find the supervisor, the potential supervisor. Okay, that's the first thing, and then you need to cooperate. You need to discuss with your potential supervisor about your project. Okay, and it should be worked together and find appropriate project that you will be interested in this project. Also, it will be well connected with the field of science that is represented by the supervisor. Okay, so the project is very crucial because the committee, the recruiting committee, analyze your project. Okay, and then it's very good question about the changing. So generally, you shouldn't change your project in the general way, but if something happening, we are in the clinic, you have a patient, so you can sometimes it happen that you need to change something. So it is possible. You need to have an agreement from our director of the doctoral school, and you can change your project. So it is possible, but generally it's quite rarely situation. So before you apply that, you need to really think about it. The project must be feasible. You need to understand that it is realistic, and you need to also have the funding for that. Okay, so imagine: is it complicated? Is it feasible? Can you cooperate with the hospital and many other things? You need to imagine about it and discuss with your supervisor, with the professor. Okay, that's really crucial thing, because sometimes it happens that we do see very ambitious projects, very interesting, but then after 1-2 years, we do see some problems with the project, and then PhD students or supervisor want to change that. So do it wise, smart, and think about it. Okay.
The core of the project is unchangeable.
Yeah.
But you can add something more to it
Sure.
to extend it.
Always in the science, you can always extend something.
No, I say something also.
No, what I want to underline, Joanna is a good example, that if you want to do PhD, you have to choose the professor with whom you want to collaborate. So first learn if you are able to bear this man or this woman for 4 years. Because sometimes you can think, oh, I have fantastic project, but then after 1 month you realize that I cannot stay together with this person. So if you go and you join a student scientific group in some department, So you can learn what you want to study. This is one thing. But second thing, you can realize if you really are happy in this environment with this all people. So because it's very crucial. You have to spend at least 4 years, and you need to be creative and happy. You know, if you are unhappy, don't lose these 4 years. Yeah.
That's right. No comments. No comments. We like each other with my supervisor. Okay, so that's all from me. Thank you.
Okay, so now it's my pleasure to introduce Professor Aneta Radziwiłł-Walicka. Professor will tell you a little bit about her work, about project, how to apply for the project, how to find the funding, and a little bit about cooperation with different universities. Actually, we met with... Ja mam. Ja nie używam, bo myślałam, że mówię głośno. Okay, so we met with Professor Aneta at Trinity College Dublin. So why it's my really great pleasure to introduce Professor, and I hope, Professor, if you're ready, you can start the lecture. Now Professor is in Krakow, Jagiellonian University. Professor, do you hear us?
Yes, hello. Hi.
Hello. Good afternoon.
Good afternoon.
You can start if you're ready. Yes.
Perfect. So thank you very much for the invitation for such a great day. Thank you, Professor Iwona Inkelewicz-Stempniak and the Doctoral School. I just will share with you my screen right now. 1 second. But for some reason I could not deal. Yeah. Looks like I do not have access. Okay, just give me a second.
The project is that the scientific is and if you are able to discuss the problem,
Oh, yes, I got it. Thank you very much.
if you have publication before
Teraz powinna móc.
then you have additional points. So the experience in the field is that because somehow you need to demonstrate that you will be able to do it. So if you have some experience in some techniques, methods, so these additional. Yeah, of course, if you are first author, but everything in our website.
Okay, so now we can start.
Thank you very much, Professor Ivona. So once again, thank you for invitation and possibility to introduce my research work. And so I would like to just convince you today that research is such an important factor to shape society and health, basically. Few words about myself. So my name is Aneta and I finished pharmacy at University of Gdańsk, Medical University of Gdańsk, which is a fantastic place, and congratulations that you are here. Then I moved to Ireland when I started my PhD in the School of Pharmacy at the Department of Pharmacology, and I did my PhD my supervisor was Professor Marek Radomski, and then decided further to improve my knowledge in platelets field. I moved to Canada and I started my first postdoctoral fellow at University of Alberta under supervision of Professor Paul Jurasz. Then I decided to move back to Europe when I got another postdoctoral fellow place at Glostrup Research Institute in Denmark. And then I started next postdoctoral fellow in another hospital in Denmark, which is called North Zealand Hospital. And finally, right now, I'm working at Jagiellonian Center for Experimental Therapeutics at Jagiellonian University. And I received a Polonez Peace Fellowship. I would like to introduce my work first when I was during my PhD, when we look at platelets cancer interaction. So there are clinical evidences linking thrombosis and cancer. First, the presence of cancer increases the risk of venous thromboembolism, and patients undergoing surgery for cancer have a higher risk of VTE. However, oral anticoagulation does not reduce mortality from all types of cancer. Therefore, in addition to coagulation systems, other thrombotic mechanisms are likely to be involved. Then, few words about platelets. Platelets are coming from megakaryocytes. When they are resting, they have discoid shape. Upon activation, they will form pseudopodia and release different growth factors to facilitate thrombus formation. And finally, they aggregate. As we know, they are crucial for physiology, and as well, they play a role in pathological processes. There are three main receptors in platelets. GP1B, which is responsible for adhesion of platelets via von Willebrand factor. GP2B3A, they are the most abundant receptor on the platelet surface, responsible for final aggregation, and as well p-selectin, which is stored in alpha granules in platelets, and upon activation, it's translocated to the membrane, and it's responsible for platelets leukocytes aggregation. Platelets are crucial for cancer progression, unfortunately. Firstly, they play a role in angiogenesis, which is crucial for tumor vascularization. Then they play a role in invasion, where they release matrix metalloproteinases, and the cancer can spread further through the healthy tissue. And finally, they play a role in metastasis, where when the platelets cover cancer cells in bloodstream and facilitate it to move to another part of the body. But do platelets affect cancer cell survival from chemotherapeutic agent-induced apoptosis? This was topic of my PhD study. And I grow cancer cells, ovarian cancer and colonic cancer in the lab, where further I incubate in the with or without platelets and treat with paclitaxel. And as you can see from this dose response curve, the platelets rescue cancer cells from survival. To conclude, the data demonstrate that platelets increase adenocarcinoma cell survival, proliferation, and chemoresistance to standard anti-cancer drugs. And modulating this cancer cells platelets interaction may offer a new strategy to improve the efficiency of chemotherapy. Then I would like to introduce you the work which I did during my postdoctoral fellow in Canada. So as you know, nitric oxide is such an important gas, which is released in physiology from endothelial cells together with prostacyclin. It's responsible for blood pressure, but as well it's produced in platelets. Nitric oxide is produced from L-arginine in the presence of oxygen and endothelial nitric oxide synthesis. It's act of soluble guanylate cyclase, and finally it's linked to inhibition of one of the most important platelets receptor, which is GP2B3A. There are clinical evidences linking nitric oxide with cardiovascular disease. Impaired platelets nitric oxide production predicts presence of acute coronary syndrome. Moreover, platelets of acute myocardial infarction patient exhibit a lack of cycling GMP increase after sodium nitroprusside stimulation. Therefore, we wonder whether some of these findings can be explained not by changes in platelets' ability to generate nitric oxide, but by changes in the levels of platelets with and without the ability to generate nitric oxide and mediate inoscycling GMP signaling. So hence we hypothesize that platelet subpopulation exists based on the presence or absence of inossignaling pathway within platelets. We isolate platelets from healthy volunteers, and we stain with DAP, which is chemical substance, and it's acting with nitric oxide where it's present. So as you can see here from this bar graph, there are about 12% of platelets which have low or not producing nitric oxide, and about 80 or over 80% they producing nitric oxide. We confirm the data using fluorescence microscopy, and as you can see, there are some dim platelets indicating that they don't produce nitric oxide, and dim and bright platelets which contain nitric oxide. Then we decided to go farther and look at their enzymes such as endothelial nitric oxide synthesis. So we stained platelets with CD42B, which is marker for platelets, and further we subjugated and we received two peaks. One which not producing nitric, which not contain enos, and one with containing enos. And as you can see from this bar, there was significant statistically that around 20% of healthy platelets from healthy volunteers not contain enos, and around 80% contain enos, platelets containing enos. And the data we confirm using confocal microscopy. Then we decided to look how these platelets actually, if they have any functional difference, there is actually a functional difference between these two subpopulations. So we stimulate platelets with collagen, and as you can see here, the enos negative platelets were more reactive compared to enos positive, which were very crucial for our further investigation. So we came up with this kind of acid platelets hypothesis that enos negative subpopulation, they start form thrombus formation, and the enos positive, they release nitric oxide, they form the bulk of the clot, and as well they limit the clot formation. To conclude that, we discovered there are two human platelet subpopulations based on the presence or absence of enos, and enos negative platelets, although less abundant, are more reactive than enos positive, and they initiate a thrombus formation. In addition, enos positive platelets form the bulk of aggregate and limit thrombus formation, of course, via nitric oxide generation. Of course, the clinical significance of two platelet subpopulations still need to be assessed. Then I would like to move to another project during my work in North Zealand Hospital. That was the work together, that was teamwork basically, between hospital, radiometer, the company, and as well one of the technical university. And the project, the goal of the project was to develop an integrated new point of care analyzer for emergency department and intensive care unit in hospitals, basically to reduce time of diagnosis and to increase healthcare system productivity, and of course, reduce the pressure on hospitals. So the idea was to develop, we were responsible to develop new anticoagulant formulation, which will be used in the new smart POC analyzer instead of sending to the main laboratory biochemistry in the hospital. So as you know, to measure all these clinical, clinical factors, we need heparin and for hematology DTA. So our goal was to develop a new antithrombotic formulation based on heparin, and we decided to add one of the antiplatelets drugs. For example, we use prostacyclin analog in order to inhibit coagulation, platelets, and leukocyte activation in a single tube. So the single tube will be, it's a novel antithrombotic formulation which will measure both hematological, biochemical, and as well D-dimer analytes. And the new antithrombotic tube is a lithium heparin tube preloaded with liquid form of prostacyclin analog, which is more stable than prostacyclin. And we have collaboration with different departments in the hospital, and we collect blood from 187 patients with the new anticoagulation tube, and as well with gold standard tubes such as EDTA, lithium heparin, and sodium citrate. And we measure 17 hematological parameters, 14 biochemical parameters, and as well the dimer against their gold standard tubes. This is kind of blood smear from the blood where we have EDTA. You can see there is red blood cells and neutrophil. And where we have heparin, we can see there's platelets, some aggregates, and then we tested different concentration of ilopros, which is, as I said before, there is like a more stable analog for prostacyclin. And then we plot Blunt-Altman plots for different parameters, blood parameters. Between the new tube formulation and gold standard. And this is kind of example of a lot of different parameters. And as well for biochemistry, we did similar analysis. We of course just realizing there are some outliers. So the red dots, so which indicates that maybe for some patient this tube will be not good enough. Therefore, we started trying to investigate what kind of patient was and just solve the problem. To conclude this work, so we describe a novel antithrombotic formulation to measure simultaneously analysis of 32 blood analytes. And this kind of tube could reduce the volume of blood. It is kind of significant, especially for long-term hospitalized patient and as well a pediatric patient. In addition, the new formulation has a potential to allow measurements of glucose and homocysteine due to stabilized blood cell metabolism. During this work in this hospital in North Zealand, I have a lot of collaboration with medical doctors, and one day to the emergency unit arrived patient after COVID vaccine, and they asked me to investigate what could happen to this patient and how they could behave, basically how could they treat maybe the patient, because it was kind of unusual situation for them. So as we know, after COVID, there were a few vaccines introduced to the market, and I would like to concentrate on the Vaxzevria produced by AstraZeneca, and over the world there was some cases of rare type of blood clots, and after receiving the AstraZeneca or Johnson & Johnson vaccine in the United States. So the occurrence of multiple thrombosis with a short time and the same thrombocytopenia and consumption of coagulopathy was highly unusual. So we investigate the 30-year-old woman who developed thrombocytopenia, portal vein thrombosis, and cerebral venous sinus thrombosis in the second week after she received the Vaxzevria. I actually isolate her platelets and just wanted to look further into. So I hypothesized that a VITT patient, virus-induced thrombocytopenia, thrombosis with thrombocytopenia, patient blood samples have elevated levels of platelets microparticles, which affect thrombotic reaction. When any cells are getting activated, they release different microparticles. So what I decided to measure the microparticles in the patient blood, and this is patient and this is healthy donor. Actually, this is my blood because at the time I didn't have any ethical committee agreement to take blood. And as you can see, there is a lot of microparticles, about 10% compared to mine 3. There's only one patient. And then I decided to stimulate the platelets with ADP, which is a not strong agonist, and TRAP, which is very strong agonist for platelets activation. And as you can see here, compared with the healthy volunteer, the patient remain platelets which are left over after the stroke, they didn't get activated. They basically showing kind of tiredness, so they not respond as healthy volunteer platelets. So then I decided to ask my colleague from the clinical department if they could look at the thromboelectrography and look how the thrombus is formed. This is clinically proved technique used very often for clinical intensive care patient. And as you can see from here, the maximal amplitude, it was kind of showing a decrease in numbers, which means the clot, it's not stable, the patient clot. To conclude this investigation, so there is a phenomenon of the receptor platelets desensitization refractory to stimulation by ADP, adenosine diphosphatase, and TRAP due prior activation in VIT patient samples. And the desensitization of platelets to ADP may be an adaptive response preventing major thrombotic events. And recently, actually, I was in the conference, Gordon conference about megakaryocytes and platelets, and with a lot of interest actually about VITT patient, and as well my poster was very interested to look like a lot of people were very interested to look at it. So I was actually very happy. And then I would like to introduce my work here in Krakow, where I received the Polonez Bees fellowship from a National Science Center of Poland. Few words about the Jagiellonian Center for Experimental And now I would like to just introduce you the National Science Center of Poland. I'm super grateful to receive this funding. So please look at the video. So that right now I would like to tell you a little bit about my project here in Jagiellonian University. So we know there is clinical evidence linking tyrosine kinase inhibitors with cardiovascular risk in patients. So the tyrosine kinase inhibitors, they are medication used in chronic myeloid leukemia, and they induce platelet dysfunction in patients. As well, they induce vascular toxicity. Therefore, it is important to understand how the TKIs affect platelets in the pathophysiological processes that can lead to impaired endothelial function. And the effects of tyrosine kinase inhibitors on platelets and endothelial function could be associated one with another. So based on my previous data with ENOS, we link the ENOS platelet subpopulation with sick pathway. And we decided to look further in these processes. So we hypothesized that tyrosine kinase inhibitors, by affecting Syk-mediated pathway, may potentially cause the platelets dysfunction and consequently impair endothelial integrity, and this effect relate distinctly to ENOS-based platelet subpopulation. And the aims of the project will basically bring a novel knowledge regarding platelet subpopulations, Syk low or Syk high platelets, and their functional effects on endothelial barrier integrity. Moreover, the project will elucidate the effects of tyrosine kinase inhibitors on platelet subpopulation and consequently platelets-dependent effect on endothelial barrier integrity. And hopefully will as well provide a proof of principle clinical study to test whether chronic myeloid leukemia patient untreated and treated with tyrosine kinase inhibitors may have impaired ENOS or Syk-based platelets protection on endothelial barrier integrity. So we're still working on this project. And now I would like to show you how it's important basic research, transitional research, and as well teamwork to save lives. And one more video from Albert Einstein Medical Institute to show one of Dr. Mark Einstein will just tell briefly about it.
Excuse me, Professor, but we can't hear you, the voice. Maybe it's because the microphone or...
So that was, yes, I hope I convince you that transitional research, basic research and teamwork is essential to develop new treatment and diagnostic for the patient. So thank you very much for your attention. I really appreciate your time and enjoy your research.
Thank you, Professor, for the presentation. Not everything was working, but it happens sometimes. Actually, maybe do you have any question to Professor?
Yes?
The future plans, what are the future plans in your project?
Excuse me, could you repeat?
Okay. Hello, Professor. Thank you very much. Very nice presentation, very interesting results. My general question, Michał Pikuła from this university. What are the future plans in your project?
Excuse me,
The
what?
future plans, project?
My future plans,
yeah.
okay.
In your
My
studies?
future plans, you know, I'm passionate about science. And I think that actually teamwork together with different people with different discipline, chemists, biologists, engineers, medical doctors, this is kind of amazing possibility to work together to develop basically better treatment. As we know, there is a lot of limits in medicine in terms of diagnosis and as well treatment or side effects of the treatment. So I wish to develop actually and work in Poland to just make Poland such a great place to do research, because I think we have fantastic possibility to do it. And I wish as well that Poland as well will be kind of great place and center for the world that, for example, we specialize in one kind of part of research. Maybe it's difficult with be great in a lot of different disciplines, but I think that will be fantastic, and I wish that I could get more funding and have a lot of as well different students from all the world and people from Poland moving to different countries to take some knowledge and come back to Poland to bring their know-how and develop better treatment basically for patient and for society and as well globally. So that will be my great wish, and I hope will happen one day. And I think right now it's already going on this fantastic work, and I'm grateful that there are such a great places in Poland to do and professors to do research. So yes.
Okay, thank you very much once more. And if you have any question more, always you can email Professor, guys.
Sure.
I know that Professor will help you with everything. Because and we were lucky actually with our mentor Professor Radomski, so I have to emphasize this, and I think that Professor agrees with me. As well, we love platelets, if you see, and work with blood platelets is our model in science, so I think it is very interesting. Okay, thank you once more.
Thank you very much. Thank you very much, and enjoy your research.
Thank you.
And good luck with all the fundings application.
Yeah, thank you. And now,
You're welcome.
okay. And now Agata will present you and share with you her experience to be our PhD student. Yes, first year.
Okay, so good afternoon, everyone. My name is Agata Knabe, and I'm a PhD student, and also I'm the chairwoman of the Doctoral Student Council. So maybe I will not talk about my PhD experience because I'm on my first year, but I will talk about our council, Doctoral Student Council. So, who we are and what we do. So the council currently consists of 9 elected members. At the heart of our council is the presidium, and our presidium included the chairperson, the vice-chairperson, and secretary, and also treasurer. So as the Doctoral Student Council, our mission goes far beyond formal meetings or internal communication. We represent the doctoral students before university authorities and external institutions, ensuring that your voices are heard at every level of decision making. We advocate for PhD students' rights and needs, whether it's about improving working conditions or supporting your academic development. So at the same time, we actively promote both academic and social engagement. We believe that strong science goes hand in hand with a strong community. So that's why we organize events, support networking, and encourage collaboration across disciplines and universities. So what we do, and as the Doctoral Student Council, our work is diverse and deeply rooted in our commitment to representing and supporting the PhD community. So we actively represent PhD students in delegations such as Polish Association of Doctoral Candidates and Doctoral Forum of Medical Universities. We also organizing and are organizing events and conferences also with collaboration with University of Gdańsk and Gdańsk University of Technology. We are hosting integration and social meetings, managing our social media platforms, writing formal requests to the rector for improvements and well-being initiatives. So you can also have an impact on our future. Proposing changes to university regulations, participating in important university decisions. We are representing doctoral students before university authorities and other institutions, as I mentioned, and we are supporting doctoral students in difficult situations. So, to be more specific, we're submitting proposals to the board of the Polish Association of Doctoral Candidates. We're also hosting the Doctoral Forum of Medical University convention in Gdańsk, and we also co-organizing the Young Science Congress. And what's more, we're providing funding support for PhD student participation in the Young Science Congress. You heard today Professor Radziwan Balicka, and last week we had an opportunity to host her. So we also organize guest lectures for doctoral students. And it's a great opportunity to gain valuable insights and practical knowledge. So being a part of our doctoral student council is more than just a role. I think it's an opportunity to grow up. You can develop leadership and project management skills. You can influence the doctoral experience at your university, build mindful academic and professional networks, gain visibility and recognition within the university community, and what's the most important, make your voice heard in matters that affect you and your peers. So yeah, thank you for your attention. And do you have any questions?
They will have questions when they enter.
Okay. So, okay, I... Mm-hmm. Mm-hmm. Okay, so like we are open to talk about difficulties that the students are faced. So they always can contact with us, and we are staying open for this. Even it's they need, for example, financial support for a conference or something like that. And we also heard problems of PhD students, and then go to university authorities with proposals to them. Mm-hmm. 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 So yeah, okay. The doctoral government is all PhD students, and all PhD students choose, vote for council, and then council vote for presidium. For 2 years. For 2 years. Presidium is for, yeah. Mhm. 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 Yeah, exactly. Thank you. Okay.
I would like to just underline that I think that this Doctoral Student Council is a great initiative, and please remember about it, because this is a very, very important person also for you to communicate, and this council can support you. So just to the future PhD student candidates, this is the information for you, so you don't have to contact direct with the director or vice-director of the doctoral school. But if you have any questions, comments, and some doubts, there are some great people that you can just ask them to help. So I think it's a really great, idea, initiative. So thank you very much for that.
So, okay, I think it's now time for our PhD students to take the stage and share their personal journeys through the world of doctoral research. So, please welcome to the stage Dagmara Kroll.
I would like to just mention that Ms. Dagmara Kroll, she was the former chairwoman for Doctoral Students Council. So after her presentation, I encourage you to ask her questions, because she also has a lot of knowledge, and she's ending her journey with PhD. So fingers crossed for a positive outcome. I believe it will be. And yes, so we are happy to have our doctoral students who are going to present you very short presentations. Please ask questions as much as you can, because it's the best opportunity. And what I can say, doctoral, doing a PhD is a fantastic opportunity for your life. You will remember this forever. If you came here today, it's a good sign that you want to pursue your goals, pursue your dreams, and actually that you would like to invest in yourself. And this is the best investment you can do for your life. Thank you so much.
Okay, so hello everyone. My name is Dagmara Kroll, and yeah, this is my 5th year, so you can already tell that I'm prolonging a little bit compared to the typical and like probably the best way to do a PhD in 4 years. To be specific, it's 4 years and 7 months right now, and I hope to complete in within a month, maximum 2 months. Okay, so to start with, the first thing I wanted to tell you about is why I chose to do my PhD. So I'm a pharmacist. I graduated from Medical University of Gdańsk, and when I was in my 3rd year, I joined a science circle in the Department of Pharmaceutical Chemistry. And at the start, I had no idea what I was going to do in this science circle, because it was about 3D printing. So something very lightly related to pharmacy, let's say, not very much. But then it turned out that it was very interesting to me, and I got deeper into it. And as I was getting deeper, I not only learned how to use 3D printers, which was more of a hobby, but also how to connect the 3D printing with analytical chemistry, pharmaceutical analysis, and how it all works within the field of research. So what drew me to start my PhD was basically a group of people that I met there. So this is our research group that I joined with my assistant supervisor in the middle and my colleagues. We started to work together over 4 years ago now, but this is something that Professor Dzień mentioned. So you need to choose your supervisor and your research group carefully, because you will spend a lot of time, and sometimes you will also face frustration and some difficult emotions. Not everything is going well every time that you want it. So it's good to have someone that you can talk to and that you can really discuss, that you can open your mind and really speak your thoughts. So my PhD project, my PhD thesis is about making a thermoplastic materials and then transferring them into, let's say, sorbent devices. So I'm working to prepare new sample preparation methods involving 3D printing. So this is what 3D printing looks like. And then I moved to something more difficult, so not to 3D print with materials that are commercially available, but to make our own materials. So we know exactly what is inside. I used these machines, I had to use them for the very first time, and I had to learn everything from the start. So from my perspective, PhD is mostly about learning. So each day, each month, you have to learn something new. Even if you already think that you know enough, it's never enough, and you always have to learn something more. So I made the thermoplastic materials, and then I create things like this, small things that that you can fit into a simple test tube. I had a lot of freedom to shape my research project, so because of the fact that I have really good contact with my supervisors, it's always an open discussion. So they have ideas, I have ideas, and we can combine them. It's not that I only have to do the comments, I also have a lot of input in the project. What the typical day looks like. So Joanna already mentioned that each day is different and each day is surprising. So usually you could think that every day should be more or less centered around PhD project. There is what I call a fun part of PhD projects, so the research, the laboratory work. And there is the other part. So at some point you have to describe your research and you have to sum up the data and you have to write a manuscript. So it's not always the fun part, but sometimes also fun part. Then there are a lot of administrative matters, more that you could think of when you are already thinking about starting a PhD. It can be surprising, but this is something that we have to deal with every day. Aside from administrative matters, there are also grant applications, so the ways to have the funding. Then there are different research projects or didactic projects that you get involved into basically with time. So when you start, you are not very deeply in the life of the department, you are not very deep into the didactics and stuff, but then you learn everything and then you get involved more and more and more, and it takes more of your time. Then for me it was Doctoral Student Council, so I was in the council for the previous over 3 years. I am in the council still. I was president for a year and a half, let's say. It took a lot of time, but it was also very satisfactory work. And now I'm also employed in the department, so there is also this part of every day. Some of these things are connected, but then after some time you learn that basically everything is connected, and it doesn't make things easier. And let's not forget that it's really nice to have some personal life and social life in this all. But yeah, so as Joanna said, every day is different. It's really difficult to prepare for the way that you have to plan your days and weeks and months when you are doing your PhD. But yeah, this is something that you learn with time. So at some point it's overwhelming, but then after a week or two it stops being overwhelming. About some unexpected challenges. So from my perspective, technical problems. I had several technical problems with instruments and for like once, for example, it took over 4 months. 4 months in the 4 years, it's quite a lot. So it's really difficult to, well, you can't really prepare to have technical issues, but it's really important to have a plan B for when it happens. Then there comes the additional responsibilities. So you have to combine it, and your time is not like unlimited. You have to prioritize things. I also faced some health issues, and this is something probably the most challenging throughout the PhD, because this is something that is even difficult to tell to your coworkers. That it's not usually like nobody wants to be like the weakest part of the group. So it is difficult in different ways. So from my perspective, it's very important to have the plan B, and then C and D, and maybe even plan E for what if something happens wrong. And I would love to say that usually it's easy, but it's fairly easy. It's really good to have some plans for what if something happens. About grants. So I was not a primary investigator in any grant, but currently I'm involved in one of the international grants for the National Center for the Research and Development. And this is due to the fact that one of my supervisors is the primary investigator in the grant. From the beginning of my PhD, I was also involved in the Sonata from National Science Center. Also, my assistant supervisor's project. Then I had a chance to take part in the Navaster, so the project for mobility, which is held by our doctoral school. Really great thing, and if you get accepted to the doctoral school, keep it in your mind that you can take part in it. And I had an opportunity to spend 2 months in Brussels, Belgium, at Vrije Universiteit Brussels, and I had the chance to meet really great people, and it was also a great networking opportunity, which resulted in the fact that my assistant supervisor has now written a grant together with the Belgian side. Then there are also internal sites, so our university internal grants. So the Young Researcher Support Program, and there you can apply for different kinds of support. So also for participation in, for example, a conference, but also for your projects. And the Young Creator of Science, which is like the also an internal grant, but more competitive, I would say. And I wanted to mention different NAVA programs, so the Valczak program, which is very good to know about, and I'm not actually sure if still everybody from our university knows about it. So this is a mobility program which is specifically for people who are working within the disciplines of medical sciences, pharmaceutical sciences, and health sciences. And the funding is really great, and it's for the, I think, from 1 to 6 months of mobility. And I am actually currently applying for that grant. I'm waiting for the results. This is my second application, so again, not everything always goes according to the expectations. About my experiences with writing. So I'm finishing my PhD, so I have already the papers, several papers, and I only wanted to give you some advices. So the first advice I wanted to give you is that always remember about backing up your documents, because it's really, really painful experience if you lose something that you were writing for several weeks or months. And then to be consistent, because you might have a bad day, might have bad mood, and you can just not feel like writing today, but each one sentence is getting you closer to the finished manuscript, so it's really worth to write anything, and maybe you will change your mind in the middle of the third, fourth, fifth sentence. Then don't be afraid to ask for advice, especially more experienced researchers in your field. So you can always ask your supervisor, you can ask your colleagues, You can ask fellow PhD students, and yeah, think well about when to create your graphics, because this is something that happened to me several times. So I was, at the start of writing, I thought, okay, I know what graphics I want to make to include in the manuscript. And then during writing, the idea changed. So I had to do it twice or 3 times or 4 times. And it's always like one of the most difficult part of this job for me. About the biggest success. So I don't want to say about one particular success, but I remember this like kind of milestones. So for me, it was participating in first big international conference, which was great amount of inspiration to meet some other teams from similar field of science, to see how they work, what they are working on, and I started to feel like included in this world of research. Then publishing papers. Each paper is your success, and just remember about it. It's also, PhD is also an opportunity to meet wonderful people, and it is both within your research group, within your research field, but it is also, for example, in the Doctoral Students' Council, so please also keep it in mind. And this is also another advice from my side, so remember to reward yourself for your successes, because it is easy to focus on the on things that do not go well. So it's really making it easier to balance your life with PhD when you remember about rewarding yourself. And yeah, the final accomplishment is obviously the thesis. So I'm hoping to finish soon. So this is for me. And if there was one thing that I wish I knew that before starting my PhD. I was thinking about this question, and I think that I was really lucky, because I was lucky with my research group, and I was lucky with my project, that it goes more or less according to the plan. But I think that the biggest advice I can tell you, based on my experience in the Doctoral Students' Council and listening to other PhD students, is that it's really important to choose the right supervisor and right research group. Because even sometimes you might not know them. So you might find someone in different university, or you might be outside from this university, and you might find someone who does wonderful things, very interesting things when it comes to science, but you don't know what this person is like. So if you have an opportunity to even spend a week or 2 weeks of an internship in the summer before you start the PhD, it can already tell you a lot about what the person is like and what the research group is like, because it's really difficult to be a lonely island and to just work on your own. So yeah, it's good to have someone that you can rely on. Okay, so thank you. So this was my story about my PhD journey. But if you have any questions, I would love to hear them. I think it's working.
So, all right, right now, yes. Okay, so I have a quick question about like creating your research group, because as you said in the first minutes of your presentation, you said that you were in a scientific circle when you got to meet each other. And yeah, for example, for me, it's the same thing, as I am in scientific circle, and I have my colleagues that like the same topics as I do. But does the doctoral school provide you with the opportunity to meet people who are interested in the same topic? Like, for example, if I meet someone in my scientific circle and they like the same things as I do right now, but then when I decide to go to the doctoral school, for example, and there is something that interests me and doesn't, and they don't like this topic, is there some kind of tools for connecting people who like the same thing? Or are you just on your own, you just have your supervisor and the supervisor helps to gather these people all together?
I think it's more on the supervisor side, or at least maybe even not supervisor side, but maybe on your own, basically. So the doctoral school, it would be really difficult to help within it. But sometimes it's good to, for example, attend the networking meetings, because there you might find someone who is working within the same field and you might not even know it. But mostly this kind of work is on your side. So to attend conferences that gather the same topics or similar topics, or to find someone, for example, find a paper on ResearchGate and just directly contact the person. Maybe this person might be from the other side of the globe, but it is an opportunity to contact and to get in touch with someone who works within something that you might find interesting.
Okay, and one more question, because, for example, in our studies in medicine, we don't have that much of mathematical aspect of everything. And how do you guys manage with, for example, statistical analysis? As for us, sometimes it's a little bit of struggle. Do you find yourselves the member of your team that is, for example, from, I don't know, technology university and knows this topic very well? Or do you just have to get this knowledge and do this on your own? How do you guys manage with that?
So from my personal perspective, we like to know exactly what is done. So, and our statistics are not so, let's say, elevated. Mm-hmm. We do not require some very sophisticated statistical methods. So we do all the statistics on our own. But our university also provides support with statistics. So you can also get in touch with someone who already just is very experienced in the field and can either advise you with the right methods or maybe even do it as a part of collaboration.
Thank you very much.
Are there any other questions to me?
Well, if I may add some to your questions. First question. Thanks. Our yearly reports that I mentioned in my introduction give the platform. So PhD students from same discipline or even from other disciplines learn what, for instance, Dagmara is doing. And if they are interested in some kind of collaboration, why not? Of course. And of course, also we encourage other people who may be interested to come. Not always it happens, but at least they have the opportunity. So that's one. What was the second question? Because I also had statistics. In the program, there's also a subject called Basics or Rudimentary Biostatistics. So for somebody who has zero knowledge, it may be enough. But as Dagmara said, we learn by fighting. Okay.
Dagmara, I have a question. As ex-chairwoman, what special advice would you have for PhD students who have just started their PhD, and what is the biggest mistake the PhD students are making in start of their PhD?
Oh, that's a tough one. So, but the mistakes, because I think everyone's PhD is very much different, and it depends a lot on the person who is doing it, and also it depends a lot.
Just a typical PhD.
Yeah, there's no typical PhD, so it depends. But I would say that the biggest mistakes that I see from my perspectives are the communication things. So if you start something, and for example, this is a story that I heard. You work in your research group, and you get information that you should do this and that, and someone has a personal thought that, okay, I don't think this is a good idea, but still they are doing it. So this is, from my perspective, the biggest mistake, because it's good to face the questions and it's good to face the different perspectives at the beginning, because before you dedicate your time and your efforts to doing something for weeks and months, and then maybe at some point your supervisor or your colleague also comes to an idea that maybe it wasn't a good idea from the beginning. So the communication, from my perspective, is the most important part, just to speak your thoughts freely. And the advice, do not try to postpone things from the beginning. So if you think that you are capable of doing something this month, this year, try to do it this month or this year, because with time you get more responsibilities and it's just getting more difficult.
Thank you.
Okay, so thank you very much, Dagmara. I think it was really interesting and you gave us a lot of helpful tips. So now, please welcome to the stage Xiaoshan.
Good afternoon, everyone. First of all, I will thank you to the Doctor School to invite me to here share my experience today. So, in this talk, I will go through the 7 parts. So let's start with the short self-introduction. So my name is Xiaoshan Mai. I got my master's degree in pharmacology in China. And after graduation, I worked as a research assistant in both China and Germany. And previous, my research is stem cell, liver, lung cancer, and autoimmune disease. And now I do my PhD study in Department of Pharmaceutical Pathophysiology, and which funded by Horizon 2020 Research and Innovation Program. It's the Marie Curie's ITM. My PhD research is pancreatic cancer organoids, nanoparticle-based medicine, and the role of the platelets in cancer progression. So let's move on to the first question. Why did I choose Medical University of Gdańsk? So as many of you may know, the MEUG is one of the top ranked medical university in Poland, and with a strong reputation both in clinic and research excellence. And it provides a vibrant environment research and great support for the international students. So this is my first reason to choose medical university. And second important is my program, the Marie Curie, the MSCA, is emphasize the international, interdisciplinary, and intersectoral training, which perfectly match my interest and my career goals. So here is my project. It's called a PRECORD, Pancreatic Cancer Organoids Research. So this one is our official website, and our work group consists of the 15 beneficiaries and the 7 partner organizations, which located in Germany, Sweden, Netherlands, Scotland, Ireland, Italy, Spain, and Poland. So in Poland, beneficiaries is our department, Pharmaceutical Pathophysiology. We are focused on experimental nanomedicine, platelet pharmacology, and target cancer therapies. The head of our department is Professor Ivona Inkelevich-Stepniak, who is also my supervisor. So now in our lab have 12 members. So our department also received several grants, and a few of the proposals under review. Therefore, my specific research topic is the effects of nanoparticle drugs on pancreatic cancer organoids and the cancer-induced platelet aggregation. The objectives is firstly, we're building patient-derived pancreatic cancer organoids platform. then observing the crosstalk between pancreatic cancer organelles and the platelets, and then explore the effects of synthetic severe nanoparticle drugs on patient-derived pancreatic cancer organelles. So here I made a science communication videos. It was the last year. We want to introduce our project to public, for example, the kids. So now today, you also can know about our project in a simple way.
Raka trzustki i leki nanocząsteczkowe. Czy wiecie, że trzustka to ważny organ, który pomaga nam trawić pokarm? Czasami jej komórki rosną nieprawidłowo, powodując raka trzustki, poważną chorobę, która może bardzo zaszkodzić ludziom. Rak trzustki jest trudny do wykrycia i cechuje się szybkim tempem wzrostu, dlatego naukowcy go badają, aby pomóc chorym wyzdrowieć. Porozmawiajmy o tym, jak naukowcy hodują komórki nowotworowe. Stosowane są dwa typy hodowli. Hodowla 2D i 3D. W 2D komórki przytwierdzone są do płaskiego podłoża, przez co mają nieco ograniczone możliwości pokazania tego, co potrafią. W 3D komórki rosną we wszystkich kierunkach, jak w naszych ciałach, pomagając naukowcom lepiej zrozumieć nowotwory. Czy wiecie? Hodowla 3D nazywana jest organoidami i małymi wersjami organów. Organoidy są jak miniaturowe trzustki hodowane w laboratorium i wykorzystywane do badania raka, pomagając w ten sposób naukowcom trafiają prosto do naszej krwi i precyzyjnie leczą chore komórki. W naszych badaniach używamy leków nanocząsteczkowych, które przerywają interakcje między organoidami raka trzustki a płytkami krwi. Te litery, czyli małe stawki kosmiczne, odnajdują komórki nowotworowe strzeżone przez krwi i zapobiegają ich podróżowaniu.
I hope you enjoy it. Okay. Apart from conducting research, publishing during our PhD also is important. So you can share your research with other scientists by your publication papers. If you are, even you are PhD students, if you have the innovative idea, you can also apply for research grants by yourself. So it's like the NCN Prelude is specific, designed to the young scientists, like they will support your own idea. In addition, our university also offers the internal young scientist funding every year to support your research. Except for the lab work and publication, you also have the good chance to get the network and outreach. For example, I was invited by National Contact Point of Poland during the NAVA MSCA weekends, gave a short talk to share my experience of the MSCA program. And also the video you just watched was invited to the research nights under the theme Women in Science. In my program, we have a secondment. So I spent around 4 months to Germany, have a different research experience. So this experience is very valuable. It provides you have like the contact with other researchers and expand your network and also increase your new techniques. Of course, if you want to getting this international experience, like last PhD student said, you can also apply for the mobility and exchange program by the NAVA, because NAVA also offer this kind of funds. So in our program, so we also hold annual the meeting. For example, 2021, we was in Germany, so the participants come together to share their research programs and discuss the challenges, also strengthen the cooperation across the partner institutes. And was 2022, we were in Spain. We had extra training, for example, ISE Business School. And 2023 was in Sweden. There was a forum. That's why I present a poster. Last year, we conclude our project was in Netherlands, because that time, the April, Amsterdam is so beautiful, so we also enjoy the tulips. Okay, apart from the internal, the project meeting, the PhD students also encouraged to participate in a larger conference. For example, our university also organized the International Interdisciplinary Scientific and Training Conference in Gdynia. And I was invited to the Leiden for the ESOF 2022, the satellite event. Also, our program, the Marie Curie, have the annual conference. So I was there online. 2024 ESOF was in Poland, and this month, this year, the annual conference of MSc was in Krakow. So in this big like a conference, you also have opportunity to present your work. For example, I got the first prize of the scientific presentation in our university's conference, and the best night talk in life science section in this span, the conference. During this conference, you can ask the Thailand scientists the advice and the suggestion and enjoy the nice work. Of course, our PhD not only work, we also have the beautiful life and enjoy your life. For example, because our lab is international, so I invited my colleague in this year to Chinese Spring Festival celebration and the Confucius Institute. And we have one Indian student. She also invited us to her Indian festival during Christmas. And also we know the MUG is in Gdańsk, a very good tourist city. So you can walk along Old Town and the seaside, enjoy the beautiful scenery all around the year in the Gdańsk. Okay, to wrap up, I have some suggestions for the future candidate. So So first, understand your motivation, know yourself, know what's your interest. Then export the right research area. So choose your interest research topic and the supervisor. The last is keep on doing. Just do it, open to learning, and cultivate your scientific thinking and cooperation ability also are essential for your PhD study. So thank you for your attention and wish all of you have a beautiful, nice career future. Thank you.
Okay, thank you very much, Shoshan. It was really inspiring. And now, please welcome to the stage, last but not least, our PhD student, Ashfaq Ahmad.
Bismillah ar-Rahman ar-Rahim. So, first of all, I have a question for all of you. So, have you ever lost someone that you love the most and you feel helpless despite all of your resources? So, have you ever lost someone that you felt helpless despite all of your resources? So, that's what happened to me. But before dwelling to that in deep, let me introduce myself first. My name is Ashfaq Ahmad, and I'm a first-year PhD student in medical sciences in the Department of Embryology under the tremendous supervision of Director Professor Jacek Witkowski. Of course, we have collaboration with Professor Eva Brel, Head of Department of Pathophysiology. But before that, I would like to thank our directorate, the deputy directors, and Gatanabe and Dragma. I don't exactly pronounce her name, but sorry for that. So today my presentation is about that how Katlang, a small town in Pakistan, I ended up here almost, I traveled for 8,000 kilometers. I ended up in Gadans. As I said earlier in the start of this introduction, I lost my father to epithelioid mesothelioma, which is a type of lung cancer. I lost my uncle to cirrhosis, which is a type of liver cancer. And recently, my aunt, which is I love the most, she diagnosed with stage 3 breast cancer, and she's about to go through dual mastectomy. So that is, I think at that time I felt helpless, but I decided that I have to go to and I have to choose medical sciences, and I have to help all of those who are fighting this deadly disease. And we have high hope with Professor Jacek Witkowski that we will find something bigger that we can help the humanity and for the ages to come. I was lucky. I got accepted to 5 different universities. First, I got acceptance from Swansea University of UK, but that was self-financed, so I declined that. Then I received another offer from Beihang University, China, that was under the China Scholarship Council. The third offer received from, and in the same year, all of these offers in the same year, I received the third offer from the University of Warmia and Missouri in Alston. The fourth offer, sorry for the name, I cannot pronounce it, the University of Resho. And of course, last offer I received from the Medical University of Gdansk. At that time, I was curious at which university to choose. And I have to recall my professor said to me, my ex-professor, my master case supervisor told me that you have to choose your next supervisor more wisely than your life partner. So at that time, I was more curious, so I had to go through the supervisor profile, and then I inspired the work of Professor Jacek Witkowski, and I chose him my supervisor for my PhD thesis, and that's why I'm here. Okay, so what we are doing in our current project, so currently we are working on a very small, very minute enzyme, which are colpans, but very powerful than what we think. Colpan can be responsible for cancer, Alzheimer, apoptosis, and many things. But at the same time, we don't know about the actual role of colpan, particularly in resting lymphocyte. So that's why we are doing this project, and we have high hope that this project will bring something that we can find a cure for the cancer, for autoimmune diseases like for Alzheimer or rheumatoid arthritis, etc. So another question, how much freedom I have during my PhD. As I said earlier, this is my first year. I still remember when I approached professor for acceptance, so he gave me some outlines at that time that if you want to go PhD under my supervision, you have to make a research proposal. And at that time, I had to download many papers. I worked on the research proposal almost for 3 days without eating enough foods. I prepared a research proposal and I've sent to professor. And after 2 days, I received his response, positive response. And he said, yes, I'm happy with your proposal and you can apply to the university. So I think I have enough freedom. Any PhD students would like to want, particularly in their PhD lifetime. I designed my own research work. Professor guided me through each and every step. But I have enough freedom to do my PhD. So I think that is the most important point. So what is a typical day in a lab looks like? So I think the first, as a PhD student, you have to do is experimentation. Experiment is part of your daily life. Of course, sometimes it's getting paired, as in my case it did. You have to collect data, you have to analyze data, and you have to continuously learning for the whole day. Of course, you can, I don't like coffee, so you can drink tea, but you have to manage all of these responsibilities by experimentation, by collecting data and analyzing your experiment, and of course, sometimes the experiment getting paired again and again. So as I said earlier, not every day goes smoothly as we expect. Of course, not as a PhD students, but in a normal life, not every day goes what we want. So my experiment got contaminated again and again. The reason was unforeseen. We could not analyze that what went wrong. But we, at that time, we sat and we discussed that what went wrong. And we are hopeful that this time it will get our own ways. But to be honest, the most important thing that you have to learn from your mistake. During your PhD, you have to analyze your where I did wrong. So you have to analyze your mistake and you have to learn from your mistake. But the most important things that you have to stay positive. I remember when the first time when my experiment got contaminated, so the professor told me, no problem, that's how we learn. So this is your first step and you have to go for years. So this may happen. So I think that was the positive response I received from the professor side, and that kept me going, and that's why I'm here, and we are working on that project continuously. Regarding the grants, we don't have any grants yet because I'm still in first year, but we have applied for Young Researcher Award, and we have high hope that we will receive this funding. But at the same time, we are planning to apply for the NCN, NAWA, and other European program, and we will get it. So the most important things and the most important part of any PhD student is publication. You have to collect data, you have to analyze data, you have to write, you have to rewrite, and you are getting criticism from your professor side that you did wrong, and you have to rewrite again and again, and then you have to submit your paper. So this is the part of your daily life as a PhD student. You have to write, as I said earlier, you have to write, you have to rewrite, and you have to submit your work. And after months, the journal decline your paper publishing. So that is the part of any PhD, I think. But you have to go through, you have to be positive, and you have to strong enough to submit again with the most positive way. The little wins and big meanings. So not every day rewards you something amazing. So as I said, when I write something and I sent to my professor, and when he said, good, so that what kept me going. And up to date, I have wrote almost 2 review paper, and I'm working on a 3rd one. And I'm in the first year. So as a PhD student, you have to write again and again. So what I wish I knew before starting PhD. To be honest, I don't have any type of wish, because I think I have enough knowledge what I'm doing right now. But one thing I'm certainly missing is I could not brought my jacket from my home, because in the winter in Poland, especially in Gdansk, it was too cold. So that is the only regret I have. Apart from that, everything is good. So I think research is not, for every PhD student, research is not a project. It's a commitment to help others who are fighting for deadly disease. As in my case, my research, I want to honor all of those I lost through my research, and I have high hope that I will, at the end of my PhD, they will be happy to see what I did for them through my research. Thank you so much for your attention. If you have any question. Thank you.
Thank you very much. Thank you for, let's say, mentioning me. Right. We are moving to the next part of our day, and I would like to invite Ms. Karolina Derda, yes, from the International Cooperation Department and Erasmus. Już prawie. Przekazuję narzędzie.
Hello. Some faces I know. Okay, my name is Karolina Derda. I'm working in International Relations Office next door, and I'm responsible for mobilities for students under Erasmus Plus program. And today I will tell you some about possibilities which this program gives to students. Okay, first I would like to give you information where to find us on internet. We run a website, this is the address, and there are information about program, but more details you will find on extranet. We also run social media in English, and we have a profile on the Instagram and on Facebook. So you can be updated with our activities, hours, and also welcome point, because we are one office and we support each other. Erasmus program gives opportunity for students to travel for studies and for internship, but for PhD students, for doctoral students, you mainly can go for internship abroad to any enterprise, research institute, hospital, laboratory, whatever you want. It can be public, private, but it can't be university. I will tell you something more about it later. Which countries are possible as a destinations countries? These are mainly European Union countries. There are 3 groups of countries. They are divided because of the difference of the scholarships. Okay, this possibility to go for internship, traineeship, it's a different name. There are 2 types of these mobilities. You can go for long-term internship. It has to be for minimum 2 months of stay and maximum 12 months of stay of your physical stay. And there are also short-term internship, and it includes minimum 5 days of your physical stay and a maximum 30 days. And recruitment is very easy because we don't qualified students, but it's simply you have to deliver us complete set of completed and signed documents, which you can find over our website, and this learning agreement for traineeship, which includes our details, or your names, our institution, the institution you go to, and the program you want to follow, and signatures. In case of doctoral students, the signature of your supervisor is okay. And also, except of this learning agreement for traineeship, you have to give us invitation letter with all details of the institution you're going to. And that's all. And the only rule is that the program of a traineeship must be related to your field of study. So what you study is quite important. Each student can advantage of an internship once in the academic year, but you can go several times. So every year you can go once, and maximum you have 12 months to use for all your stay as a PhD student. There was some. Okay, here are scholarship for long-term scholarship. You will get 820 euros per month, but it depends on the country of destination. But usually it's 820 euros. And for short time, we pay for every day. So it's 79 euro per day. Additionally, from this year, we also add the green travel lump sum or standard travel lump sum. So it depends what kind of transport you use. If you use these low emission means of transport, you will get more money, and if you use airplane, you will get low sum to the scholarship. But it depends also on the distance calculator, so we will count where you're going, what's your destination, and we will add it to your scholarship. And when you come back, it's also easy to be settled because you have to only give us a certificate of attendance, which confirms the dates of your stay. And you have to complete the online survey, which the link you will find on your email when you come back. So that's all with us. Oh, and these are information about us, the email, the address of the Facebook, Instagram, and our web page. Any questions? Okay, thank you very much.
Thank you very much. That was very informative, and possibly some of the students will use it in the future. Okay, now the topic called ACE2EU Alliance Office, Ms. Katarzyna Bruder. Are you with me? Yes. Okay. You're welcome to the floor.
Hold on, because I think we lost track of the pen drive. I can connect through. Let me just organize the logistics. Do I have to use the mic, or can you hear me? All right. Okay. Hi, everyone. Thank you very much for having us here and inviting us to this interesting meeting. My name is Katarzyna Bruder, and I represent the Office for the ACE Alliance that has been recently created at our university. What I wanted to show you today is what we can offer you as ACE Alliance. ACE has invited our university last year to join a very diverse community of 9 universities, and let me just show you the acronym. As it goes for, ACE goes for Applied, Connected, Entrepreneurial, and Engaged European University. This is actually our motto, our daily motto when we come to our office and we engage in our daily activities. Applied goes for the activities that we want to offer to our academic community. We want to create joint educational offer, joint activities that will have an applied and practical focus. The connected part goes for basically connection, creating joint units for management of the alliance, joint units for creating short learning opportunities, and joint communication within the alliance. Entrepreneurial goes for promotion and generation of innovative solutions, and also all the activities that we create want to nurture an entrepreneurial attitude. And finally, engaged. This is what we are working on at a daily basis. We want to engage both internal and external stakeholders. We want to forward and direct our activities and our didactic opportunities to our partners in industry, in business and society. As I said before, ACE Alliance is an alliance of 9 very much diverse universities, very innovative and very engaged toward the solutions that we want to offer to our academic ecosystem. And as you can see on the map, going from the west part, we've got the lead university, Santarém Technical University in Portugal. Then we go to Spain, University in Madrid. Then coming closer to Poland, we've got the Carinthian University of Applied Sciences in Austria, and Technical University in Germany, and Ingolstadt, then again, our university. And looking at the eastern part of the map, we've got universities, technical universities of Lithuania, Latvian Academy of Culture in Riga, and 2 Baltic countries, that is North Macedonia, and university in Târgu in Romania. As I said, the diversity of 9 universities offers not only collaboration and cooperation for our staff students, it is also 55 associated partners that are engaged from different environments. It's business, it's society, it's the area of social impactors and change makers. Therefore, we would also like to create a space for your future activities. Just very briefly, the work plan of ACE Alliance concentrates on 4 main joint operational units. The first joint operational unit is App Factory, that is a didactic unit. Then we go to ARIS, Incubator of Entrepreneurship, and then Space Center. As much as we would like to go to space, looking at the current trends in entertainment, Space Center is a place for creating inclusive academic environment. And finally, the 4th joint operational unit is eCampus. This is a digital space that we would like to offer to our students, our staff, for sharing joint resources. Wanted also today to show you the space that we offer you at our website. Let me just double check if, yes. Nope. Okay. I'll forward the presentation to you. We have a dedicated website on which we specify and direct all the learning opportunities and all the activities that you can enter, get involved in at our main website of Medical University. And then, yes, I would, from the main website, you can also access the Alliance direct website, where I would strongly encourage you to get familiar with 4 spaces that we offer at hand. So basically, before we develop all the learning opportunities and all the activities for all our stakeholders, we can offer you a direct access to our newsletter, where you can find the up-to-date activities and information on what is happening currently at the Alliance, on what is coming up, and all the newest insights into our activities. There is our Gumet baby, which is the idea box. This is our creation, the creation of our promotion and communication unit. And this is the space where you can actually share your ideas and have an actual influence on what is happening and what is being implemented within the alliance. So basically we have space for creating 10 additional activities that we can implement within our plans, work plan. You can also access ACE podcasts. This is something, it's not only podcast, it's also a video cast. You can see the crucial management board people who explain to the academic community how the Alliance can support the development of our daily work. And finally, something that we are waiting for, that's the virtual escape room. This is, at the moment, just an idea, but we are currently trying to involve students and our employees to co-create this space. I would also like to invite you to our upcoming conference, during which we will share with you the idea of how the Alliance works, what it can offer in the upcoming 4 years of the project. We have invited 40 guests from our Alliance, mainly work package leaders, management board, and people who are directly involved in all the activities. So if you have space, please register to the conference. You're very much welcome during our presentations, where you can find out on the latest achievements and the upcoming planned activities. You can also access our social media, directly our office on Instagram, LinkedIn, and on Facebook. Of course, the Alliance has also the same set of social media profiles, and hopefully we would be really happy to welcome you in our office at the Rectorate building in room 110. So thank you very much. If you have any questions, go ahead.
Thank you very much. That was very, very informative. And for prospective PhD students, you see the opportunities that open, and they will be available to you if you join. Okay, last but not least, Ms. Marzena Kołtoniak, and this is support for international doctoral students. The floor is yours. Wszystkie tylko nie tam.
is Marzena, and I'm the half of Welcome Point. The other half is Emilia, she's here with me. And we're both dealing with different kind of problems you may find here in Gdańsk at this university. Our office is downstairs in this building, and it's a space when you can always come if you have problems, questions, or you want to talk. We're always open. Oh. Shut it. Which one? Here. Okay.
Ale to przełączone nie jest przełączone. Momencik,
Yes.
momencik.
Oh,
Potrzebujemy...
Okay, so what you can expect when you're coming to the Welcome Point? You can expect support before you're coming to Poland and also while you're here. So if you're at the stage that you're still in your home country but you have questions how things will look like, or like any doubts you have, you can email us, call us, and we will try to answer all your questions. Then you're coming here and you're getting the support here in Poland, in Gdańsk. So we're helping with all the things you might face here. So everything what's not connected with your field of study. Yeah, this is the other thing. This is the place you're coming to the office here, and they are helping you with your studies. We're helping with all the other stuff. The third part of what you can expect in the Welcome Point is all kinds of integration. So we want you to also have some fun, to meet people from similar countries, from different countries, to learn about the culture of Poland and also of the culture of the countries of your colleagues. What things we're helping with at the Welcome Point? It's all kind of legal matters. So for the most important thing is the legalization of your stay, but also all kind of understanding different legal documents here in Poland. We can help you a little bit with applying for a bank account, address registration, all kinds of things you can face in Polish offices. You know, Polish bureaucracy might be challenging. But also we'll help you with your healthcare, so we'll try to advise and guide you if you can, if you want to have the public health insurance or the private insurance. Basically, we will try to show you all the advantages of different types of the insurance you want to choose. We will help you and tell you where to go, what to do when you're sick, and also if you don't know where to go, we'll try to, if we don't know, we'll try to help and find you the right place to find the answers. Also, when you want to just, if you feel unsafe or need any help or just want to talk, because people just sometimes missing home or just want to go somewhere, they don't need some help, which is like a doctor help or psychological help. They just need a person who is open to talk or smile or just have a coffee. Then you can come to the Welcome Point. The integration, so the studies, it's not only the knowledge or the studying. Yes, it's also other things, the social life, sport, activities. So we're supporting all kinds of students' activities, and we're helping them to do some stuff which are not connected with studying. Here is one of the football tournaments. They are annual every year. Lately, there's also the basketball tournament. So not only studying, also some sports. It involves not only the students of English division, it's also Polish division, and the doctoral studies are also some kind of combination, because they are joining Polish students and English-speaking students in one school, so it's also the perfect place when you can create your own team to play. Every month we also prepare in the morning coffees, high noons, different names, but the same stuff. I think here we had some kind of a meeting about the Doctoral school, I think, a few years ago. And we always have a topic, then we have some sweets, coffee, and there's a field for discussion, for meeting, for having some social life. The other thing that we love to do is the days of different cultures. Here we have a part of Indian Day, and I think we have the girls who are here today, so we're always very grateful when you want to share your culture with us. So beautiful dresses, the dances, the culture, and it's always beautiful days when we can learn a little bit about the culture of our students. Here we had the Nigerian or African Day also, so the students are cooking, dancing, they're like, you can do everything to show us everything about your culture. There's a lot of people always, we're just changing the buildings from this room, which was like too small, then we're going to Medic, which seems to be too small. Next time the Diversity Day will be in the sports center, then we can just get more people and everyone can come and see how interesting it is. So Indian, here Polish, we also learn not only about different cultures, we want to show you our culture. So we're inviting you for pierogi and vegetable salad. And last time we had the orchestra choir, I don't know, like the people from Kashuby area that were dancing and singing. That was amazing. We also, during Christmas, we don't leave you alone. We never leave you alone. If you want to join the initiative and come to the Polish family, we will organize you one. And I think some of the students already been there, and they are always like, sometimes they say it's a friendship for life. So if you're Polish, you can invite a student. If you're foreigner, you can join the Polish family. But we have some photographs from that. Also at the welcome point, every year we're decorating the Christmas tree and we're giving you the Polish traditional dishes, barszcz, pierogi. We're decorating the gingerbread cookies, and it takes the whole day, and it's always an amazing event. We're also bringing joy. So some of the students of doctoral studies this year were helping us. So we're collecting the gifts for the small patients of our clinics. And then every year we have one Santa Claus, and we are bringing joy to everyone. So as you see, lots of activities. Everyone can find something. You can show your culture, you can find help, you can come here to learn about different cultures. We're always open, we're always listening to your problems, so don't hesitate to come to us. Thank you.
Thank you very much. And this concludes the official part of our meeting. But does not mean that it concludes everything, because the space outside is still full of good food and drinks, so you are all welcome to continue. I would like at this moment to thank very, very much to all of people who organized it, especially to Ms. Marzena Licka from our office. Here you are. To Ms. Lila Kotłowska, also from our office, and to Ms. Joanna Okońska, also from our office. Bravo, and great thanks to all of you, because you were the organizers. I was just participating. Okay, also I'd like to thank everybody else who participate from whatever offices, who collaborate with us as a school. To the authorities of the university, definitely. No one is here at the moment, but at least the vice rector was here for a moment at the beginning. To my vice directors who also participated. Did I miss anybody? I did? To my vice directors, I said. Professor Antasiewicz is here. Yeah, I had to be pointed like that. I believe that Professor Inkelewicz is still here around, or? Okay. Left English way, yes? Okay, all righty. Okay, so time for possible last questions, queries to me, to all of us, whoever wants to ask a question related to doing PhD within the realm of first PhD school of the Medical University of Gdańsk. You are all very, very heartfully invited to do so. As you can see, it's not only hard work, but it's lots of fun. You will see it if you join. And what can I say? I wish you all good luck. It's not so easy to get it. Not everybody who applies is automatically included. The rate of, nowadays the rate of inclusion is 1 in 2 for all 3 of disciplines. So you have to show that you are the best. That's how it works.
Unfortunately, you will not get any additional points by
No, this does not give you additional points. Perhaps we should, but for now, it's not there. All right then. Once again, thank you very much. And I hope to welcome all the young people who are here as PhD students of our school sometime. Thank you very much. And everybody is invited outside to the goods. No, szczerze. Przecież to włączone. Przyłączyć?